Hello, I'm Dr. Greg Maguire of Neogenesis. Today I wanted to share with you some information about the different stem cell types that are used to make skincare products. And to do this, I'm going to share a few slides with you so that we can better talk about the use of skin-derived adipose mesenchymal stem cells that we use here at Neogenesis versus bone marrow-derived mesenchymal stem cells that some other companies use. Those bone marrow stem cell cytokines cause drastic actions. As a matter of fact, and I'll show you in a couple of minutes, in a recent medical journal, it was shown how bone marrow stem cell transplants, because the bone marrow has within it many different types of bone marrow stem cells, some of which are cancerous, that those bone marrow stem cell transplants can transplant into the recipient cancerous stem cells. Actually, recently, an 11-year-old boy died because of this. So we'll go into that in just a few minutes. But what stem cell types are resident in the skin? Of course, it's skin-derived adipose mesenchymal stem cells. They reside in the dermal layer as well as just underneath the dermis in the fat pad. They're resident in most all of our tissues throughout the body. They're there to maintain and heal all of our tissues. Whereas the bone marrow stem cells, they are, of course, resident in the bone marrow. That's where they're made, and they egress from the bone marrow and they go into the blood. And they're called into action in tissues outside of the blood supply only when there's a wounding event. So bone marrow stem cells come into the skin very transiently, and that's for a reason. They didn't evolve to be in the skin for very long periods of time. They're just during times of wounding present in the skin, and they're there to fight severe infection and to fight severe wounding, and in doing so they cause very drastic actions. We'll go into that in just a moment here. I wanted to re-emphasize, I've shown some of this to you before, that adipose mesenchymal stem cells in your skin protect the skin cells from oxidative stress. They do so by, amongst other mechanisms, by releasing a lot of antioxidant proteins. Likewise, adipose mesenchymal stem cells rebuild the normal matrix structure of our skin. The adipose stem cells cause the upregulation of a lot of matrix proteins, including collagen 1 and 3. So a mix of collagen 1 and 3 is required for normal skin architecture, whereas bone marrow stem cells will predominantly release and cause the release of collagen 1 and cause fibrosis. Again, the exosomes containing the molecules from the adipose mesenchymal stem cells protect us from scarring. The adipose mesenchymal stem cell molecules protect us from photo damage and protect the stem cell niche, all that matrix around the stem cells, protecting the stem cells and causing them to work more efficiently. Chronological aging, again, these are all PubMed, Medline listed articles, so the science is first class. And here again, adipose mesenchymal stem cells are shown to protect the skin from aging, protect the skin from scarring, as we showed you before. And mesenchymal stem cells, adipose-derived, actually modulate the innate immune system. That innate immune system is there in the skin as well as other parts of the body and protects you from infection. And that system can go awry quite easily. Well, the adipose and you have immune problems in many diseases, autoimmune problems, and the adipose mesenchymal stem cells will regulate the innate immune system so that it doesn't produce these toxic chemicals. Rather, it's putting the macrophages, the resident innate immune cells in the skin and elsewhere, puts them into what we call an M2 state, where they're not releasing the cytotoxic chemicals that damage your own skin cells. Likewise, the adipose mesenchymal stem cells modulate the adaptive immune system. So you've probably heard about T cells. T cells are also, they have memory, And they're very clever about fighting cancer, fighting infection. And they too can go awry. And they can go into a very pro-inflammatory, what we call a Th17 phenotype. And the adipose mesenchyme, where they're releasing, again, cytotoxic chemicals to kill the infection, but also they damage your own cells. And the adipose mesenchymal stem cells will regulate the T cells so that they're in a regulated phenotype where they're not attacking your own cells. It's very important. Again, I've showed this to you before, where adipose mesenchymal stem cells protect us from all kinds of cancer. In this study, they're showing how they protect us from melanoma, both in vitro, in the test tube, as well as in vivo in the whole animal. That's very predictive of cancer in humans, that the adipose mesenchymal stem cell molecules will inhibit melanoma growth in our skin. So if we think about bone marrow stem cells versus the resident skin stem cells, at the top you can see the stem cells. These would be the adipose mesenchymal stem cells. They stay in the skin. They crawl around. They just move around. It's a pseudopodia movement where they just barely crawl around in the skin to find the area that's damaged. And then they'll release molecules and build matrix and fix the damage. Whereas at the bottom, you can see the blood-borne bone marrow mesenchymal stem cells will only rush in to the tissue from the blood supply when there's a significant wound. You want them there only for a short period of time because they're going to induce macrophages, that innate immune system, to go into an M1 pro-inflammatory state where cytotoxic chemicals are being released, damaging your own skin cells. Bone marrow stem cells are inducing a lot of fibrosis, a lot of collagen 1, fill in the wound quickly, but who cares what the architecture is all about? And that's what a scarring is. And they also, the bone marrow stem cells induce a lot of proliferation. It's another way of helping to fill in the wound very quickly, is causing cells in the wounded area to proliferate, to replicate themselves, multiply a lot of cells very quickly, build a lot of collagen, and will fill in that wound quickly. Will also cause the release of a lot of cytotoxic chemicals that kill the infection, also damage your own skin cells. Well, all these factors involved with the bone marrow stem cells are hallmarks of cancer. As a matter of fact, Dr. Hadow over in England first posed in the 1970s that tumor production is simply overhealing, crystallized for many of us in the 1980s by Professor Harold Dvorak at Harvard, was the idea that tumors are wounds that do not heal. Let's explore that concept. Cancer is a wound that never heals. So think about the skin, the normal anatomy on the right versus the damaged skin on the left. What is the difference between the two? The big difference is that the wounded skin has recruited bone marrow stem cells. And those bone marrow stem cells are in the skin releasing those cytokines. That's the big difference in a wound. And so if you have a chronic wound, you have a lot of bone marrow stem cell cytokines present in the skin. And that's the equivalent, what Dr. Dvorak is saying, of a wound that never heals, the equivalent of a tumor. So if you are taking bone marrow stem cell cytokines from a product and applying them to your skin every day, what are you doing? Bone marrow stem cell cytokines applied to your skin on a daily basis over time is the equivalent of a wound that does not heal. And the equivalency of a wound that does not heal is a tumor. So you really don't want to be applying bone marrow stem cell cytokines to your skin on a daily basis. It's the same as a wound that never heals. It's the same as a tumor. So in fact, I think I showed this to you previously in the shorter video. When you put bone marrow stem cell cytokines into tissue, in this case, they were looking in the head and neck region, and they saw head and neck cancers tumorigenesis in the head and neck. Here are some of the results of that paper. So if you apply bone marrow stem cell cytokines, look at figure top left, panel A, the middle figure, in that picture you see tumor formation. That's tumorigenesis caused by, if you look underneath, it's MSC-CM. Those are bone marrow stem cell cytokines. CM stands for conditioned media, the molecules applied to the skin or applied here to the other tissue in the head and neck, cause tumor formation. So bone marrow stem cell exosomes alone induce tumor growth. The bone marrow stem cells, and I've shown this to you previously, induce inflammation. The bone marrow stem cell cytokines actually can induce inflammatory disease states, in this case, toxic epidermal necrolysis. That's a pro-inflammatory state that's actually eating away at the epidermis. And I think something very important too, big difference between the bone marrow stem cell exosomes and the adipose mesenchymal exosomes is that the bone marrow stem cell derived exosomes have been shown to contain a MHC class II set of proteins. Now what that means is, this is part of our adaptive immune system. These MHC class II proteins actually carry a memory of a past infection, past inflammatory event. And it can, these MHC2 class proteins on the bone marrow stem cell exosome, contain a piece, a little segment of the invading organism within the MHC2 protein. And so if you have bone marrow stem cell exosomes from a donor who had a past cancerous, infectious, pro-inflammatory event, the donor exosomes may be imparting to you, when you put the bone marrow stem cell cytokines exosomes on your skin, may be imparting to you that pro-inflammatory event through the MHC class II proteins. So in other words, you're causing your adaptive immune system to respond to an infectious pro-inflammatory event that you never had, but the donor patient did have. You're needlessly activating your adaptive immune system by using bone marrow stem cell exosomes contained in those other products. Now this is very important. I mentioned to you the 11-year-old boy who died because of a bone marrow stem cell transplant. This is nothing new. The bone marrow is a site of recirculated cells, including recirculated bone marrow stem cells in various phenotypes, including bone marrow stem cells that have gone into the cancer stem cell phenotype. So the bone marrow, when it's used as a source for tissue donation, often contains dangerous phenotypes, including cancerous phenotypes. And this is where we're showing in this study that the bone marrow niche contained actually cancerous stem cells. In this study, they're showing that recirculated cancer cells in the bone marrow can remain dormant for years. That they're present, they're undetected, they're actually transmitted from donors to recipients under the best of circumstances. When the bone marrow in the donor has been thoroughly checked, it's hard to detect these dangerous phenotypes in the bone marrow. And so they're passed on through the donor tissue, whether it's a transplant or whether you're using the exosomes, the cytokines. Those dangerous phenotypes are being passed on to the recipient. Here's a paper where transmission of a large beta cell lymphoma through a bone marrow stem cell transplant was passed on to the recipient. And in a number of studies, we've seen that these bone marrow stem cell transplants have passed on to the recipient dangerous phenotypes, including cancers that will kill the patient. Now, this is, as the authors state here in this very recent 2019 article, this is underreported complication following bone marrow stem cell transplantation. The risk associated with bone marrow stem cell transplants and the use of their cytokines is highly underreported. This is the latest research in 2019. Likewise, melanoma is a risk for cancer when using bone marrow stem cell transplants. These bone marrow stem cell transplants are approved only for a couple of blood diseases, and they're only used when absolutely needed because those people in the medical profession who honestly do their business recognize the extreme risk of these cells. And you have to evaluate the risk versus reward. So if the reward is small, you never want to use these bone marrow stem cell transplants or their cytokines. If you're going to save a life because the person can no longer properly make their own blood, then you do use the bone marrow stem cell transplant. You save the life, but you recognize in the long term that patient will have complications because of the bone marrow stem cell transplant. In contradistinction, adipose mesenchymal stem cells, when donated from patients with documented cancer, the adipose mesenchymal stem cells are safe and efficacious. And when these researchers not only looked at the cells very carefully from the cancer patient, the adipose mesenchymal stem cells saw not to have a dangerous phenotype. The genetics were not perturbed. And when they looked at the set of molecules within the exosomes, they were normal. So the adipose mesenchymal stem cells, even under the worst circumstances, when you derive these cells and therefore their molecules from a cancer patient, the adipose mesenchymal stem cells and their cytokines and exosomes, perfectly safe to use. Now, with the bone marrow stem cells, they also induce high rates of proliferation. You can see the study on the left calls it expansion. And when you cause cells to replicate very, very highly, and the bone marrow stem cells do this much more than the skin-derived cells, 49 times higher in some studies, they cause, when you put them onto the skin, the bone marrow cytokines, they cause replication stress. That's a potent driver of aging of your cells. So over time, you're actually causing replication stress, aging your cells, and actually, in the long run, probably depleting the stem cell number and or function within your skin. Really quickly, I just wanted to show, in the previous studies, I showed you matrix proteins are released by the adipose mesenchymal stem cell. Here is a direct effect of the neogenesis technology, putting those matrix proteins back into the skin. Adipose mesenchymal stem cells causing matrix proteins to be formed. And after 30 days or so, you can see the matrix is rebuilt in this lady. This is due just to chronological aging, no retouch of the photos, no other treatments, just the neogenesis technology. Likewise, for congested skin, an inflammatory state, simple topical application of the neogenesis technology, reducing inflammation, reducing that congested skin. Photos are not retouched, and there was no other treatment to this patient. Laser burns, we talked about how we put in the normal matrix proteins, not just one or a couple of matrix proteins, how we rebuild normal skin architecture. It's an example of this. Brenda, who I met, had a Fraxel laser resurfacing done to her skin. Too much energy, too many jewels. Scar was formed on her forehead, as you can see on the left. That scar remained there for a year, even with the best dermatological treatment. And when she started using the Neogenesis S²M technology, after 30 days, that scar was nearly gone. Known Brenda now for several years, that scar is still gone. Now, we wanted to show you some new data here, including what we can do for surgical scalpel wounds. This is an example where tissue was cut with a scalpel, so scalpel surgery to remove ping pong size tumor, and simple topical application of Neogenesis S²M after the surgery. 1 year later, I don't think you can tell this person had surgery. Likewise, rebuilding the skin, preventing damage, I'm going to show you in just a minute, but rebuilding the skin, quelling inflammation, reducing the redness, really alleviating radiation dermatitis. So this is a patient treated with radiation for breast cancer. And the normal sequelae on this is weeks of pain and inflammation and redness, brittle skin. Skin is so fragile that the patient doesn't want to touch it, doesn't even want to put clothing on top of the skin. It's just that painful. And in a matter of days, the redness, the inflammation, the pain was quelled. And you can see in a matter of weeks, that skin returning to its normal architecture, normal color. Now, here is a patient going through radiation treatment and scalpel surgery, so breast reconstruction after the treatment. And you can see that the radiation dermatitis is greatly reduced. So just using the Neogenesis recovery prevents the radiation dermatitis. So we know now, and physicians recommend it, that you can put products on before the patient goes in for the irradiation. So if you put the Neogenesis technology onto the skin prior to being irradiated, it will protect from radiation dermatitis. And also, you can see here with the scalpel surgery that those scalpel scars are greatly mitigated using the recovery. So I wanted to thank you. This was a quick presentation of the Neogenesis technology versus some of the other technologies out there in the marketplace. We have papers available and longer videos. And if you would like to explore any of this in greater depth, please reach out to us. We're available, and we can give you the papers or send those longer videos off to you. Thank you very much.